Today, this lesson we'll be looking at the body planes. There are three main body planes. It's the frontal plane, it's the sagittal plane, and it's the transverse plane. So the frontal plane is basically a line that divides the body into two halves. You've got the front, we call it the front view, which is the anterior view, and you've got the posterior view, which is the back view. Then you've got exercises that you can do on the frontal plane, such as your shoulder lateral raises. Then the next plane we've got is the sagittal plane. The sagittal plane, what it does, it cuts the body into half, meaning you've got the left side and the right side. For example, if you are doing a shoulder lateral raise, you are exercising in a sagittal plane. And the last one is the transverse. The transverse plane, all it does, it divides the body into lower body and the upper body. Now, what we'll do in the next slide, I want us to look at the different terminologies or anatomical terms that we use to explain the planes even further. So I'll look at the first slide. The first slide, we're going to make use of the weights. Let's get the weights. We're going to look at four key movements. The first one, we call it the flexion. Now, remember the presentation on the muscle contraction. We looked at the flexion and we looked at the extension. Now, for example, if you are doing a bicep curl, when you are doing that, that's a flexion. You are flexing your arm and the bicep muscle, it contracts. Then when you drop the weight, we refer to this movement as an extension. As you can see, you flex and you extend to make it longer. So let's try it again. So this is the flexion and this is extension. The third movement we've got there, we refer to it as a dorsiflexion. You can put down the weight. The dorsiflexion, that's the movement of the toe towards the shin, basically. Can you see? That's a dorsiflexion. It's almost like when you are driving a car, when you are deaccelerating, you do a dorsi. So why do we need to know this? When you are doing your calf, you plantar flex and dorsiflex. You can plantar and dorsiflex. So the next one is called plantar flexion. So plantar flexion is this. Basically, you plant your toes. For example, if you are doing your gastrocnemius exercises, that movement is a plantar flexion. So you plantar flex in that way. You can go up and down. So it's a plantar flexion. So you plant your toes. Plantar flexion. Okay, so that exercise, it works on your gastrocnemius, on your calves. Okay, let's carry on. And the next one, we're looking at something called abduction and adduction. Remember, there's abduction, which is double D, and abduction, which is big D. Now, the first one, double D, is motion towards the middle line. For example, if I'm abducting, I do something like you move from here to here. Okay. Come on. Yes, facing. So you start here and you move like this. So the movement starts here and it moves like this. So now imagine you're pulling a weight. When you are adducting, you train in this position. Then you go back without weight and then you pull the weight. So that movement is abduction. The next one, which is a twin to this one, is abduction, which is ABD. It's the opposite. Here we exercise in this direction. So the first movement, we're working on the muscles in your inner thigh, like your gracilis and all of them. The second one, which is abduction, we are working on the hip or on the side of the thigh. So if you try those type of movements, so that's abduction. So the key thing, you have to memorize the terms and know them by heart. The next one we're going to look at the movements of the scapula. If you remember on your anatomical presentation, we did say that the scapula has got 4 movements. You can elevate the scapula, you can depress the scapula, you can protract the scapula. So those are the different movements of the scapula. So the first movement we have, we call it the elevation of the scapula. So when you elevate, it's something like this. So if I want to give him weight, if he has to do shoulder shrugs, the shoulder shrugs with the weight is an elevation of the scapula. Remember, it's the elevation of the scapula. Elevation of the scapula. Elevation of the scapula. And the next movement of the scapula, we call it the depression. So the depression, you first elevate, then you depress. You elevate, you depress. So we call this the movements of the scapula. You can drop the weight. The next movement is called the inversion, which is the lifting the medial border of the foot. Now, the medial border of the foot is here. So now, when you do inversion, so it's basically that movement. Try it. Now, somebody might ask a question, why do we need to know all these? Usually when we work with long distance runners, if we want to choose the running shoes for them, we look at the feet. So they've got 2 types of feet. A foot that is invaded, or a foot that is like this. We call that eversion. Now eversion is that movement when the foot is like, it's like this. I'm not sure if the camera can get it right. So it's in and eversion. So those are the different movements that we can have there. So I want us to carry on and do more of these. And the next one, we're looking at rotation. Rotation. Now we're looking at joints. Rotation could be that movement. Basically, you rotate. You can rotate like that. You can rotate your arms like that. And the next one is pronation. Pronation, that's when you exercise in that position. It's more like, it can be more like a bicep curl in reverse, like that. So you can take your weight. So you do that. It's a bicep curl, but in a pronated movement, which usually we do that to work on the forearm. And the next movement is supination. Supination is that movement. Supination. So your palm, it faces forward like that. Then you can exercise in a supinated position. So try it again. So when you do bicep, you can do bicep in a supinated position, or you can do bicep in a pronated position like that. Now, the next thing I want us to look at, you can drop the weight, is the anatomical position. Now, the anatomical position, you stand like this. Now you put your feet together. That's number 1. Feet together. I know your first year exam, there's a question where you have to define this. So it's your feet together, and then you face forward, like you're looking right at the wall. Your back must be straight, and your palms must face forward, and the chest out. So we refer to this as the anatomical position. So let's go through it again. You put the feet together, pointing forward, chest out by keeping the back straight. Your eyes must look forward, palms on the side of the body and facing forward, and that is called the anatomical or the standing anatomical position. And the last thing we'll look at is just a few more definitions and terms that you need to know as fitness students. The first one is superior. You know, there are things we refer to as superior in the human body. Now, the definition of superior, it says towards the top of the body, meaning anything that is on top. For example, my shoulder is superior to the elbow. Then the opposite of that will be inferior. Inferior means at the bottom. My elbow is inferior to the shoulder. And the next one, you've got your anterior. I did talk to you about anterior. That anterior is the front view of your body. And we pair anterior. If you look at the anatomical terminologies, they are all paired up. You've got posterior at the back. You've got anterior in front. So anterior is the front view. That's what we see when you are looking this direction. And the posterior view is basically the back of the body. So you remember when we did the skeletal system and the muscle system, we analyzed the body in these two views, the anterior view and the posterior view. The reason why we do this, when you turn him around, for example, if you look at the muscle system, if you turn the athlete around, posterior view gives us your anterior deltoid, it gives us your pectoralis minor and major, it gives us your abdominal muscles, it gives us your hip flexors, it gives us your quadriceps, but it doesn't tell us what is at the back. But when you turn the athlete or the client around, what you see at the back, you can't see it in front. Now once you turn him around, you begin to see the trapezius. You begin to see the scapula and all the muscles. You begin to see the rhomboids, the lats, the glutes, the hamstring, and the gastrocnemius. So you cannot analyze all these muscles unless you turn it around. So the next one, you can come back. The next definitions we have is something we call medial and lateral. Now medial basically is towards the center of the body. So more inside, we refer to that as the medial, and more outside, we refer to that as lateral. And then we've got proximal and distal. Proximal, it says that situated closest to the point of attachment. Close to the point of attachment. For example, my bicep, it attaches there, which is proximal. But now, the insertion, if you remember, we spoke about the insertion and the origin. Now, the origin is closer, meaning it's proximal. And then the insertion is far, meaning it is distal. So you've got the two types of terms there, which is proximal and distal. And I'll leave it there for now, and I'll see you in the next presentation. Thank you so much for watching.